Hi, everyone. Welcome back to Healing Insights. This is episode number 2, Understanding Vitalism and Its Role in Naturopathy. I'm your host, Dr. Tara Coppola, and I am ready to take you on this fascinating journey to discover what vitalism is and how it incorporates into your health. Today, we're going to explore the definition of vitalism, its fundamental role in naturopathy, how it informs healing practices, and even how you can recognize if your healthcare provider practices vitalistically. All right, so grab your cup of tea, grab your cup of coffee, settle in, and let's get rolling. Let's kick things off by answering the crucial question: what exactly is vitalism? Vitalism, at its core, is the understanding that living organisms are fundamentally different than inanimate objects because they're governed by a distinct vital force or energy. The roots of vitalism can be traced back to ancient philosophies where cultures like the Greeks referred to this force as pneuma or qi in Chinese medicine. The essential premise is that the vital force interacts with the physical body, maintaining health and facilitating natural healing. You want to think of it as your body's unique energy that's guiding your healing processes. Isn't that such an amazing idea? It resonates with many different spiritual and philosophical traditions around the world. Now, let's connect the dots a little bit between vitalism and naturopathy. Naturopathy is a truly holistic approach that strongly incorporates the vitalistic principles. Through the foundations of healing, naturopathy understands and embraces the idea that health is more than just an absence of disease. I'm going to repeat that again. Health is more than just the absence of disease. Health is about creating harmony in the body systems. Vitalism is central to this view, treating patients as whole beings rather than merely a collection of symptoms. Naturopaths use natural remedies. A naturopathic practitioner is going to utilize and support and enhance the body's vital force through these natural remedies, such as botanical medicines, homeopathy, nutrition, lifestyle choices. They're all going to be utilized in unique ways to the individual to help improve that individual's vitalistic force. Then there's the self-healing idea. Naturopathy emphasizes and promotes the body's innate ability to heal itself. Just as vitalism posits that the vital force promotes health, naturopaths encourage patients to connect with and strengthen their self-healing capacities. As we talk about healing, remember, healing is a journey of self-discovery and a journey of empowerment. So, how does vitalism play out in everyday practices of naturopathy? Here are some key applications of the vitalistic principles. Naturopaths have a holistic assessment. They take a comprehensive view of patients' history, lifestyle, and emotional well-being. Naturopaths embark on a quest to understand the unique vital force of each individual. Naturopaths create personalized treatment plans. By recognizing the patient's vital force, a naturopath tailors the treatment plan to recommendations. For example, someone with a vibrant constitution might benefit from herbs that are more energizing or stimulating, while another one may need calming herbs. So it depends on the individual's vital force, which forms of the modalities will be used for that patient. Also, in naturopathy, there is an obvious connection with nature, hence the name naturopathy. Vitalism promotes a deeper connection to nature. Naturopaths emphasize outdoor activities, nutrition in its whole food sources, herbal remedies that align with Earth's natural cycles. All of these facets connect our body with the nature that we came from. Then, there's the education and empowerment facet. Now, if you heard my first podcast, you'd understand that this is a so super important idea for me, because through education, I can empower my patients to learn how to heal themselves. I want my patients to be empowered in their health and their wellness. A vitalistic approach fosters an environment where patients are able to learn about their health and encourages them to take responsibility for their wellness journey. This emphasis on education is crucial in helping patients understand their bodies, how to nurture their vital force. So, let's discuss the uses of vitalism within healthcare, particularly in the realm of naturopathy. First, we have preventative care. We discussed this in the first podcast. Vitalistic practices help prevent disease by strengthening the body's vital force through regular checkups, lifestyle modifications, nutritional support, etc., will help keep you ahead of illness. As a reminder, when we discussed in the first podcast, prevention is not 100%. However, when you're living in a lifestyle of prevention, if something happens in the body is so much more well equipped to handle it and can recover faster. Then, the next idea are the chronic conditions that we deal with. Vitalism is instrumental in managing chronic illnesses, especially where conventional treatments have fallen short. We do this by understanding and addressing the vital force. We are able to find unique strategies for individual patients that are above and beyond suppressing symptoms. When you suppress a symptom, it lies more dormant in the body and will proliferate later. We often see this through the medications we're taking with the vast amount of side effects that come up. How many times has somebody prescribed a medication only to then need another medication for the side effect that happened? Through vitalism, it's about supporting the body's inherent ability to heal through supporting its vital force. This doesn't necessarily rely on suppression of symptoms. Now, we'll talk about the therapeutic order in another podcast. However, suppression of symptoms can be needed in certain situations. Nothing is black and white. Nothing is yes and no all the time. Everything in our body, in our world, in our humanism is a beautiful layer of gray. And so there will be some times that suppression is needed. There will be some times that extreme tactics are needed, such as surgery. Absolutely. However, in vitalism, it's not the first step. The first step is getting to those obstacles of cure, helping to support the body's natural vital force. Then there is the mental, emotional well-being. This is a facet that is not often touched by conventional medicine, unless you're going to a psychiatrist or a psychologist, which have their, they do their good. Absolutely. We need them to help us sometimes. Sometimes we need those medications to help our brain get back in alignment. Vitalism is not limited to physical health. Vitalists encompass emotional and spiritual dimensions of the human as well. Techniques like meditation, visualization, and mindfulness are commonly integrated into treatment plans because without supporting the patient's mental, emotional, and spiritual well-being, we may be missing obstacles to cure that are needed to help that patient heal. And that's not okay. Emphasis in these dimensions can lead to profound healing experiences for the patient. Now, if you are intrigued by the idea of vitalism, you may be wondering how to identify if your healthcare practitioner provides treatments and modalities from a vitalistic perspective. Here are some, not all, some key ideas. They utilize a holistic approach. Does your doctor view patients as a whole being? A vitalistically inclined practitioner is going to look at the patient from the physical, mental, emotional, spiritual aspects of their life. Then there's patient education. Are you, as a patient, being empowered to understand your health and your body's healing processes? You want to look for practitioners who take the time to educate you about treatment options and the role that your internal vital force is playing on your treatment. Next, vitalistic practitioners create a customized treatment plan. They are not cut and dry protocols for every individual. It's not, if you have hypertension, then you take XYZ, and everybody with hypertension gets X, Y, and Z. That does not work that way in vitalism. The vitalistic provider recognizes each patient's individual vital force is different and adapts their approaches accordingly. Next, we have natural therapies. Are natural remedies being used as a cornerstone of your practitioner's practice? It can be anything from botanical medicine to homeopathy to hydrotherapy to dietary changes. Any of those nature-based therapies are part of a vitalistic approach. Now, this does not mean that pharmaceuticals are never a part of a vitalistic approach. However, like I've mentioned before, in the therapeutic order, they are some of the last tiered efforts. So, the final thing to think about when trying to figure out if your practitioner is practicing vitalistically is there collaborative care? Does your practitioner value collaboration and respect and honor the other practitioners of your healing team? It is critical that your healing team are working and integrating with each other. Are they integrating insights from other healthcare modalities? Are they emphasizing teamwork to support your health journey? At the end of the day, it is your health journey, and your healing team is critical. Now, identifying these different traits can open the door to understanding if your practitioner is actually practicing vitalistically. With that, I do want to set in a disclaimer, which I probably should have put in the beginning. So, all of this information in this podcast is very general in nature. I'm trying to help educate and inform and empower you in your healing journey. It is not intended to diagnose or treat illnesses. If you have a diagnosis, if you have symptoms, if you have an illness, you need to reach out to your licensed medical practitioner for diagnosis and treatment. That being said, this exploration of vitalism has been very general. There is so much more information that I did not even touch on, but I hope that it sparks your interest and empowers you to explore more. As we conclude, I want you to remember, understanding your health means embracing the power of your vital force. You have it within you. It is important to connect to it. I want to thank you from the bottom of my heart for joining me on podcast number 2 of the Healing Insights. If you have found this episode helpful, please subscribe, like, and share it with friends. If you're interested in exploring how a vitalistic approach can work for you, you can head on over to my website, www.risingphoenixnaturopathy.com, and learn more. You can schedule a free discovery consultation with me right there on the website. Your journey to vitalistic healing begins with you. Until next time, nurture your vital force, stay curious, and be well.